All right, let's dive into a bit of a medical detective story. It all starts with a single, really dramatic clue: a change in color. This is the story of obstructive jaundice, and believe me, it's one of the most important warning signals our bodies can send. So, I've got a question for you. What in the world connects these three things? Yellowing eyes, really dark urine, and strangely pale stools. I know, it sounds like a riddle, right? But in the world of medicine, this exact combination of clues points to one very specific and pretty urgent problem. And the answer is obstructive jaundice. Now, the easiest way to think about this is like a major traffic jam, or maybe a total plumbing blockage inside your body. See, we have this whole drainage system for a fluid called bile, and when something blocks it up, a yellow substance called bilirubin gets backed up. It has absolutely nowhere to go, so it starts spilling into the bloodstream, and that's when all these visible signs start to pop up. Okay, first up, let's take a closer look at those initial warning signs. This is the body's first distress call, and it's written in a very, very specific color. Doctors call this the classic triad. It's a huge clue. First, you've got jaundice, which is that distinct yellowing of the skin and especially the eyes. Second, the urine turns a dark, kind of tea-colored shade. And third, you get these pale, clay-colored stools. When you see these three together, it's a dead giveaway that the problem isn't the liver making bile, but that there's a blockage stopping the bile from getting out. So, we've seen the warning signs. Now let's play detective and head to the scene of the crime. But to really understand what a blockage does, we first need to see how the whole system is supposed to work. Meet the biliary system. Honestly, you can just think of it as the body's internal plumbing for bile. Bile is this super important fluid that the liver makes to help us digest fats. It's a really elegant and efficient network of tiny tubes and ducts, well, when it's all working the way it should be. So here's the normal, healthy path. The liver does its job, creates bilirubin, which then flows with the bile down into the intestines. It helps with digestion, and critically, it's what gives stool its normal brown color. After that, it's eliminated from the body. A perfect one-way journey. Simple, right? But what happens when a roadblock suddenly appears? Well, a blockage, let's say it's a gallstone or even a tumor, forms in one of those ducts. Now that bile and bilirubin, they literally have nowhere to go. So pressure builds, and they end up spilling backward, right into the bloodstream. Now the body's smart, so it tries to get rid of this excess bilirubin through the only other exit it can find, the kidneys. And that's why the urine turns so dark. And at the same time, since no bilirubin is reaching the intestines anymore, the stool loses its color and becomes pale. See? It all connects. And it doesn't take much for this to become visible. Jaundice usually starts showing up in the whites of the eyes when bilirubin levels hit just about 3 milligrams per deciliter. The eyes are the first to show it because that tissue just happens to have a high affinity for bilirubin. It's a remarkably precise biological alarm bell. Okay, so we know there's a blockage. The next big question is, who or what is the culprit? It's time to line up the usual suspects. Generally, the causes fall into two main buckets: benign or malignant. The most common benign cause is a gallstone that's gotten stuck in the bile duct. The key clue there is that it usually comes with sudden, severe pain. But on the flip side, you have malignant causes, like tumors of the pancreas. And here's the scary part. They often present in a more sinister way. The jaundice gets worse and worse, but there's no pain at all. And that lack of a pain signal is what makes it so dangerous. People might ignore the jaundice for longer, losing critical time. This actually leads us to a classic piece of medical deduction known as Corvoy-Zerus law. It's a fascinating principle. It basically states that if a doctor can feel a patient's gallbladder, it's enlarged, but it doesn't hurt when they press on it, the jaundice is more likely caused by a malignant tumor than a gallstone. Why? Well, gallstones usually cause chronic inflammation that makes the gallbladder all scarred and shrunken, not enlarged. It's just a brilliant example of using physical clues to narrow down the suspects on your list. All right, with a solid list of suspects, it's time to bring in the high-tech forensics. This is how doctors go from suspicion to a concrete diagnosis, using labs and imaging to see what's really going on inside. The investigation usually starts with a blood test because we're looking for a very specific pattern of clues. The type of bilirubin that's high tells us the liver has done its job, but the bilirubin is trapped. Then another enzyme, ALP, is usually way up, which signals pressure building in those ducts. Other liver enzymes are only a little elevated, and even blood clotting can be affected. When you see this pattern, it practically screams blockage, not a problem with the liver itself. Next up is imaging. You can think of this as a funnel. We start broad with an ultrasound. It's like the first look. It's fast, and it's great for spotting the main sign of a problem, which is dilated ducts. If we're worried about something malignant, a CT scan gives us a much more detailed map of the area. But the real gold standard for seeing the problem without any invasive procedures is an MRCP. It creates this incredible, almost 3D-like image of the entire plumbing system, letting us pinpoint the exact location of the blockage. So, the case is cracked, the culprit has been identified. Now it's time for the final act, clearing that obstruction and getting things flowing again. Treatment really has two main goals. Step one, and this is the immediate priority, is biliary decompression. We have to relieve that pressure to prevent infection and more liver damage. This is often done by placing a tiny tube, called a stent, to open up the blockage. Once that's done, we move to the second goal, the long-term solution. That means definitively treating the underlying cause, whether it's removing a gallstone or resecting a tumor. And there are two main ways to do this. The first is an endoscopic approach called ERCP. It's a really clever, minimally invasive procedure where a scope is passed down through the throat into the intestines to get at the bile duct from the inside. It's perfect for pulling out stones or placing those stents we talked about. Now, for malignancies, the standard of care is often major surgery, like the well-known Whipple procedure for pancreatic cancer, where the obstruction and the surrounding tissues are removed entirely. So, what's the big takeaway from all of this? I think it's that something as simple as a change in color, in the eyes, in your urine, in your stool, can be one of the most powerful signals our bodies can possibly send. It isn't just a random symptom. It's a detailed message that, when we know how to decode it, can tell an incredibly complex and critical story about our health. And that leaves us with one final question to think about. Jaundice is a pretty dramatic example for sure. But what other simple signs might our bodies be using to tell us a much more complex story? Something to ponder. Thanks for watching.